I'm glad that you discussed it with your doctor, and you should always consult with your doctor before you start any diet. Yes, about the weight, many people are not overweight, and yet they have insulin resistance, and they have high uric acid levels, and they have inflammation in their body, and they have high glucose levels. Sometimes not to the point of diabetes. The trouble is that many people tell me I'm not diabetic because the doctors say I'm not diabetic, which means the glucose is beneath 6.5. Pre-diabetes is 5.6 to 5.9, and your doctor will just tell you, just look at what you're eating, don't eat too much sugar and those kinds of things, and 10 years later you are diabetic. As I always explain, your insulin goes up to keep your blood glucose stable, and it tests normal, but your insulin is too high, so you become insulin resistant. Insulin resistance upregulates salt retention on the kidneys, and now people get high blood pressure, and then they take medication for that, and the medication is bad for your liver. Insulin resistance also upregulates uric acid retention on the kidneys, and now you have high uric acid levels. But then people tell me I don't have gout or arthritis. It is true, but gout and arthritis only start at a uric acid level of 7. From 4.5, which is very high, and upwards, you start to get metabolic problems. The arteries and the veins harden because of the uric acid, and you get vascular dementia risk of 44%, and a stroke risk of 32%, and cardiovascular risk of 38% because of high uric acid levels. To talk about cholesterol, go to video Q15, question 15 on my frequently asked question playlist, where I talk about what you can expect with the carnivore diet about cholesterol. Just want to say LDL cholesterol, bad cholesterol, has a 1.6 risk factor for heart disease. It's a very low risk factor. The higher risk factor is type 2 diabetes, which has a 10.7 risk factor. I'll tag you in the video. Of course, we are reversing type 2 diabetes with the carnivore diet. We're also reversing insulin resistance, which will reverse your hypertension and your high uric acid levels. I've got videos on that as well, Q12 and Q20 on my frequently asked question playlist on my YouTube channel, as well as here on TikTok on the playlists. But let me just summarize it for you. When you go in the carnivore diet, you can expect to get a slightly higher LDL. It is true, it might shoot up like in your case, but that is why I say discuss it with your doctor. If your doctor tells you don't do the carnivore diet, absolutely don't do it. But as I said earlier, the real risk for heart disease is type 2 diabetes. They did a study with 28,000 women. It was known as the Women's Initiative, and they did it over a 10-year period, and they discovered risk factors for heart disease. The highest risk factor was 10.7, type 2 diabetes or diabetes. Then metabolic syndrome around the belly, the measurement over the navel. If your circumference divided by your height is more than 0.5, it's known as metabolic syndrome. It's also metabolic syndrome also includes high triglyceride levels, which is the cholesterol component that goes up if you eat too many carbohydrates, because glucose is converted to triglycerides in the liver, and insulin goes up in that process, but you get a fatty liver. So that triglycerides as a 2.1 risk factor for heart disease. So it's double the risk of high LDL. Then hypertension has a 4.5 risk factor, and obesity as a 4.3 risk factor, smoking as a 2.1 risk factor. But metabolic syndrome, the measurement around the belly, if it's too big, it has a 6.0 risk factor. So again, high uric acid levels, as I explained earlier, also detrimental for your heart. But as always, made an informed decision, and that's all that we're here for. I mean, the testimonies roll in like you can't believe how people reversed their gout and arthritis and high uric acid levels, and how they reversed their insulin resistance, how they lost 30 kilos, 60 kilos, 70 kilos, 140 kilos when they needed to. Check the testimonial playlist on my YouTube channel, where I interview people who achieved those goals, reversed type 2 diabetes, made their type 1 diabetes much better, reduced their insulin use on type 1 diabetes with 65%. The videos are numbered L1 to L14 at this stage. It's on the testimonial playlist on YouTube. But thank you for your commentary. Yeah, so just to summarize, on the carnivore diet, you can expect to get a slightly higher LDL, the so-called bad cholesterol, but you can also expect to get a higher HDL, which is a good cholesterol, and you can expect to get a lower triglyceride count. By the way, insulin resistance, one of the definitions of insulin resistance is having low HDL and high triglycerides. That is known as insulin resistance. It's one of the definitions. Insulin sensitivity is known as having a high HDL, that's the good cholesterol, and low triglycerides. So the metabolic syndrome that I alluded to earlier composes of having high triglycerides, the circumference of the stomach, which is bigger, as I explained, but also a low HDL and hypertension. So that is metabolic syndrome. 6.0 risk factor. That is the real risk factor. So it's all about taking risks. If you and your doctor believe that having a high LDL, the bad cholesterol, is a very, very high risk, it's up to you. All my doctors say it's not a real high risk. The other things that I've mentioned, that's the real risk. And that's what we are reversing with the carnivore diet. But thank you for your commentary.